Hello and welcome to the Smart Connections podcast and the Talk the Path podcast. My name is Anna Sanderlin. I am a warm-line facilitator for the University of Memphis Smart Center. The University of Memphis School of Social Work Smart Research, Training, and Treatment Center aims to provide evidence-based interventions for school-based mental health programming, increase access for school-based behavioral health programming in underserved areas, offer training on best practices in telebehavioral health, develop opportunities to research the use of technology in practice, and provide direct services to the state's most vulnerable populations. You can call the Smart Center at 901-678-1636. The University of Memphis Smart Center, in conjunction with the University of Tennessee, Knoxville, and the Tennessee Department of Mental Health and Substance Abuse Services, would like to present the Pathways to Behavioral Health Careers Project. The goals of the Pathways Project are to provide education and information on the various career opportunities in the field of behavioral health through presentations, increase interest in students in the field of behavioral health, provide opportunities for guidance with information regarding college, university programming that result in degrees for professions in the field of behavioral health, connect students with students in behavioral health programs and professionals in the field for further research. This podcast will feature students and professionals in the field to give a clear picture of the daily duties of these roles and how they help support their communities.
I'm Jim Pierce. I'm originally from Morgantown, West Virginia, which is about 45 minutes south of Pittsburgh. I attended West Virginia University and earned a Bachelor's of Music and a Bachelor of Psychology. And I've always loved music. And through undergrad studies, I really had a passion for psychology. And I thought the two lived like this. And then I heard about this field called music therapy. And I thought, well, that sounds fantastic. But when I looked at schools in my area, the state of West Virginia did not have a program at the time. So I ended up going to Florida State University, where I earned a master's in music therapy and became board certified in 2005. And then life as it is, I didn't want to shovel snow anymore, and I got used to the South, and I gave up all my ability to tolerate the cold. And so I went from Florida to Mississippi. I went to Jackson, and I was a clinician during that time, and then eventually landed an adjunct position at the University of William Carey University. And I was adjunct from like 2008 to 2011. And then I took over the program about 2012 there and worked until 2021 or 20, I think 21, and then left to come to Memphis in 22. I earned my doctorate, which is in music education at the University of Southern Mississippi while I was teaching at William Carey. And so I have kind of a broad spectrum of clinical skills, because while I was in the field full time, I did part-time and contract work. And then, of course, when I took over the program, it was a very robust program, and I had a big department, and I was managing by myself. It's in Hattiesburg, Mississippi, which is where William Carey University is, and it's where, USM is too. And so when you took over the program, you're responsible for the clinical rotations. And so I ended up doing clinical work under the umbrella of an educational site. And so the certification that I have is an MTBC, which means a board certified music therapist. And it's like any other certification. You have to have continuing education credits, and there's a rubric on what numbers you make. And so you have 5 years for renewal. And that's kind of my pathway. But I originally didn't strike out to be a music therapist. I really to be very honest, I kind of stumbled upon it once I finished my degrees at WVU. I heard about that field, and the way I researched and looked into it, Florida State was a great opportunity to attend a program that was in line with my methodology of music therapy. And so it worked out really well. But my personal background, where I did my internship and a lot of my contracts, was in mental health. I worked in a forensic mental health state hospital, male and female. I did substance abuse counseling to, juvenile delinquents. So if there were, and then I also worked as a contractor for a variety of older adult facilities. And then when I went to Mississippi, I ended up an after school program with, I think the official title was the Adolescent Offender Program. Then it changed to Adolescent Opportunity Program. Essentially, they were just kids that were in a different county that you managed an after school program. It was ironically through the YMCA, but it was a grant through the state of Mississippi to help kids get back on track. And so we provided a variety of mental health services, and we bust them in and bust them out. And it was a great opportunity to get an exposure to the adolescent kind of side before they became adults. But if I had a real expertise, it would be mental health in general. That's kind of where my passion is. And I think it kind of goes back to my love for psychology and DSM-5 TR and learning those diagnoses and how music therapy can help alleviate symptoms and promote wellness.
Oh, wow. Wow. You have an extensive resume. That is very impressive.
Well, thanks. Well, it's one of those things where you don't think about it at the time. You just get older and you keep taking advantages. And I have a problem of not learning the word no. And so when a contract or something comes across, I'm like, that sounds wonderful. And so it just kind of blossomed. And the more I do, the more I realize things aren't so separate,
Right.
The contract work that I do with this population very much resonates and translates to another population. And so the skill sets trade and transfer, and I'm able to keep up and it's not, I don't see them compartmentalized as much.
Mm-hmm. Mm. Well, I was actually reviewing your biography, and I seen that you had experience in mental health, and I heard you mention about grant writing.
Oh,
and
yeah.
I also read how you accumulated about $130,000 worth of money for grants and the things that you've done. So that's very impressive.
Well, thank you. Yeah, it's one of those endeavors is if you're a coordinator of a music therapy program, I always tell people you're also a job promoter, because lots of times people don't realize because technically music therapy is an allied healthcare profession, which is why I'm able to be on this great podcast. And so you don't necessarily think of music therapy in that realm, but if you keep the umbrella of mental health, it is a very common modality to help people. And one of the issues is that people they think it's something that they have a lot of misconceptions. And so part of your job is you're always advocating for the field and you're always kind of promoting jobs. And the best way to do that is to write a grant, which if in the ideal world, the Disney World version in my head is you write a grant, you fund music therapy students, you fund research, you provide clinical services, you help the population, which is the most important thing. And then the translates into an opportunity for the administrators or whoever is keeping their eyes on this change in their patients and promoting health. They go, we gotta offer this. This should be a job for us. We should add this. And music therapy, depending on the area, can be reimbursable. And so at the end of the day, it kind of hits all the important areas. And so I had a lot of success working with private foundations. And I had one grant through the state for developmental council in Mississippi. And so I'm working on an NEA grant for veterans, and I'm working on a 901 grant for Parkinson's fighters. And so, I'm just starting to get into the point where I can get contracts and things started.
Well, it sounds like you've served a lot of populations, and we appreciate you for doing that. And, doing the dirty work by writing those grants, it takes skill and patience to do that. So,
yeah, it's like I tell people, if you apply for one grant, you're probably not going to get it. But if you apply for 10, you might get one. It's a lot of work, but you get better at it. And that's why there's people that just do grant writing. And I'm very thankful to be at Memphis, because the University of Memphis has a lot of mechanisms in place to help you with grant writing, especially when you get to like bigger, like NIH and NEA grants, which are very competitive, and everybody needs to have resources. And there's such a mental health crisis currently at every level. I mean, not just with adults, but children, adolescents. It seems it's a problem. And so that paired with music can sometimes be a great opportunity.
Right.
Okay. Yeah. Hello, Dr. Pierce. My name is Ariane Young. I'm also interning at the Smart Center, and I'm in my final semester here as well. Thank you so much again for coming to speak with us. It seems like you found the perfect combination of two things that you really love, and many people aren't able to do that. So, again, thank you for setting aside the time to come speak with us. Um, I heard you mention that you didn't necessarily want to take the route that you started with, as far as psychology, and you always had like a music background. So if you could go back in time, what would you do differently about your pathway? Or if there was another profession that you feel like you could thrive in, what would it be?
Well, it's good to meet you. And again, thanks for the opportunity. I personally don't regret any choice I made, but I do have future aspirations. And if I wasn't so, right now I'm on a lot of pretty heavy projects where the music therapy program at the University of Memphis is being accredited. And that means I'm writing a lot and I'm submitting documents. And so that's my primary focus, besides, of course, teaching and fulfilling the research and teaching component to my job. But once that's done and we're almost finished, and we should be fully accredited by the summer, I plan to maybe look at a personal goal of my own, which would be to get a master's in psychology and become a licensed counselor. Like I think that would be the kind of the crowning jewel to my education.
Mhm.
But time and finances are always things that could potentially be a problem. But if there was one thing that I would go in that route, it would be that, because I do have a psychology background. I took about 15 credits of graduate psychology work at my PhD program because it was my cognate. And I just really like it. And the more interest I have of that paired with music, I'm not 20 in my early 20s in undergrad, but my original love for music and psychology has never left me. And I feel like at this point, if I were to go back to school, I would probably get that degree just for my own self-fulfillment and to help me with facilitating lots of mental health groups in particular. It would open up a revenue source as well as allow me to kind of bridge the gap between what I'm psychoeducational topics that I work with in psychology and then bring in the skill sets of the counselor, because lots of times, depending on where you are, certain populations are more vulnerable, and you can engage in a group or one-to-one interaction, and they could have a trigger of a post-traumatic syndrome, or there could be some kind of symptomology that has been manifested through that. And at that point, those kinds of serious issues need to be addressed through a counselor. And so that would probably be something that I would do at the end of the day. Whether I do it, I don't know, but that's in the back of my mind. So yeah, good question.
Right. It seems like that would be the icing on the cake. I wish you best of luck with that journey.
Yeah,
Um,
it's a long journey too. It's not just a couple years and you're done. There's a lot of work to that. But yeah, thanks.
right. So with you working in the behavioral health field, and holding as many hats as you do, how do you manage that?
You mean in terms? Well, part of it is I have to separate and compartmentalize when you're teaching students in a clinical setting and you're working with, because one of the hallmarks of programs that the way I teach is there's kind of three parts to my music therapy program. And one is I'm really big on students understanding medical and psychological jargon and pairing that with real life experiences. So when I develop a program, we might have a class in older adults and we might talk about, different types of issues like dysarthria or some other kind of cognitive issue. And we talk about it in class. It's a bold-faced word. You lecture on it. But let's face it, you memorize that and you move on. But if you see that situation, if you see the issue that they're having that relates to that, that's a really big component. And if you're working in like mental health and you can talk about the brain chemistry and you can talk about side effects of psychotropics like tardive dyskinesia, and you can see a video of it, and then you see someone and you can work with someone, that's what really works. So there's one. The two is research, of course. And then three is the practicum. And I feel like the clinical experience that students get, I don't shield them. So when you're in a medical hospital and if you've got somebody working to recover from their stage 3 cancer, you're there. And as an undergrad, there's not much filter. I'm always there. And so part of me wants them to get that experience to know what they want to do. And I have to kind of compartmentalize because while I'm a clinician, I'm an educator. And so when we go out in the community and we're working with folks, I have to remind myself, like, I'm here for the students and the population, and I'm taking care, and all the ethics are being met, and there's a improvement in their status, but I'm also there because of the students. So I have to kind of think twice. Whereas when I'm doing my own work, it's different. It's just me, and it's a little easier to deal with because I know what's going to happen because I'm in control. And so it's different, but but I learned that early on because you have to learn that students are learning and you have to know when to kind of step in and help. And so, yeah, I guess just years in the profession has helped me compartmentalize, but yeah.
Thank you so much for sharing. I know balance isn't the easiest thing to attain, so
Sure.
you've done really well so far. Thank you.
Sure.
We know you work closely with students on campus. So, what would you suggest to young people who are interested in pursuing a career in behavioral health?
Well, I will abbreviate this, or we will be on this we'll be on this link for a while. The short is, I would, it's an interesting student because what makes a music therapy student? Like if you're watching this podcast, like, I like that, I like music. What is music therapy, and do I want to do it? Part of this component is finding that student that doesn't want to be a performer, that doesn't want to be an educator. And that immediately is my first step. Like you love music, but you don't really see yourself in a classroom and you don't see yourself performing. Well, this might be the option for you because you're going to have the opportunity to use your music skills. And University of Memphis has an excellent music program. So you're going to be having you're going to have the opportunity to use your music skills as a modality of change to show behavioral responses in the people that you work with. So this isn't something where you just passively play music and they hang out. No, this is an interactive place where music therapists are using music modality as an intervention to evoke some kind of change, which, like any other therapeutic kind of process, has an assessment, you have goals, and you have paperwork. So you have a paper trail to show why and what you do and how you do it. And so for that kind of mind, you need a flexible person who's musical and has a lot of patience and a lot of energy, depending on what population you pick. So that's the kind of mindset for a student. And as far as what they could do to prepare, the music therapy undergraduate curriculum is really close to almost earning a psychology minor here at the school. And so I would recommend them, get on guitar, get a guitar and start playing a little bit of guitar and singing, because that's the primary focus for music therapists is guitar and being able to bring music to the bedside or one-on-one or to a big group. Piano as well, percussion, of course, depending on what you do, and you'll be using a lot of percussion instruments. But the main suggestion would be to get a guitar and start to learn guitar and do that beforehand. And as far as other opportunities, if you have the opportunity to shadow a music therapist, like I'm always getting people say, hey, I want to do music therapy, but I don't really know what it is. And if you followed me around, it wouldn't do you very much good. But there are lots of music therapists in town, and I can set you up to be able to shadow somebody to get an idea. The one thing about the field is it's so dynamic. You can be providing music therapy services to a woman in labor that you've been working with before in a medical hospital, and then you could be going all the way through the lifespan and be working with somebody in the last moments of life in hospice. Well, when you talk about what is music therapy, that is quite a dynamic. You're talking about an age range that's quite dynamic, not to mention the different diagnoses. So when you shadow somebody, you might shadow somebody like you might go to St. Jude's or Le Bonheur, and that's going to be kind of a medical background. But what if you went to private practice? What if you worked in a mental health facility? It's very different depending on where you go. So if you have a curiosity about not performing and not educating, but having the opportunity to use music to promote health, and you're flexible and you're musical and creative, this would be a great pathway. And to cap it, it's an area of education where obtaining a job is very, very high. Like I think even during COVID, my students at my previous school were in like the 90th percentile. Like 90% of them got a job in their field after they graduated. And so that means they're pretty flexible. So they might not be in the city that they went to school, but they found a job, and there's a lot of opportunity for growth. And it's also, you can work at a hospital and do like a 9 to 5, or you can be an entrepreneur and you can start up your own business and do private contracts. So it's a really, really beneficial field. And as an undergraduate program, you really get a lot of skill sets that help you tremendously when going to grad school if you have the opportunity or if you want to.
Mhm. Thank you for sharing. That was great advice. I love that you mentioned the various career opportunities and
Yeah.
populations that students could work in and experience, because we all want peace of mind that we can land a good paying job after we graduate. So
Yeah. It's people don't, lots of times I always tease my students. I'm like, at some point you have to tell your mom or dad or whoever you live with, what is music therapy and why are you going to school for this? And I tell them, I'm like, it's the same conversation I had with my family. So you're not alone. And this is not a new field. This field has been around. I mean, it started at conception in World War I and World War II. And in like the 50s, it started to be a field that was credentialed, and you started to see that progression. And the current status is 1998. The American Music Therapy Association presides over the field and the profession, and you have standardized testing, you have standardized curriculum. I know this because I'm creating the program here. So I know these competencies very well. And at the end of the day, this is not some, I don't know how to say it, like kumbaya space idea. Like this is a very much a behaviorally based field that promotes wellness in a variety of populations. And so, given the crisis in mental health, it really is a unique experience to work in mental health with music therapists. I love it. And if I probably didn't work at a university, which I love, I would probably be working in a state hospital or something like that because I loved it. It was great.
mm. Well, I can hear the passion and love you have for this profession in your voice, and that speaks volume. But I also wanted to ask about your position as the president of the Tennessee Association for Music Therapy. Can you tell us a little bit about that?
I'm working on getting that name off this Zoom, but I'm new to Tennessee, so even though I'm from Morgantown, West Virginia, I have been in the South for a while. But I came to Tennessee, and there's a lot of music therapists in Memphis, and one of the positions I was elected to do was, kind of oversee the state, and it's allowed me to really get to know the music therapist and the work that they're doing. And Tennessee is a wonderful place to be because we are passing bills and legislation to get the license, the MTBC, recognized as a licensure in the state of Tennessee. And we'll probably pass that bill this coming legislative session. And we have a task force, which I'm a part of. And if and when that does occur, it will significantly propel Tennessee to the forefront of states in the United States that recognize it, the licensure in the state, and that's a big deal. So, I took that position once elected, and wonderfully with my background, because I was the chair of the task force in Mississippi, so I knew about how task force works, and I knew the need was there. And given the fact that Memphis was going to be kind of a new spot on the Tennessee horizon, I thought this would be a great opportunity to get to know folks and to get connected and to really use my experience to help where I can to help advocate for the field, not just in Memphis, but at the state level, because we're all connected. We're all in this together. And I tell people that all the time. We tend to live in a silo all the time, but really we're very much connected. And so it was a great opportunity. And we're doing some great things with TAMT, able to connect people. We're doing continuing education credits. We're bringing in guest speakers because we're not, state Tennessee is pretty big, which I will tell you a joke. I couldn't figure out why in my beginning meetings we had to have 2 time zones. And then I realized, new to Tennessee. So we are a long state. And so, we have a lot of meetings like this, and we connect students and professionals, and we try to help advocate as much as we can and get outreach and let people know what music therapy is.
Well, the University of Memphis is lucky to have you. Congratulations on that position. You are representing the university very well. So,
no, thank you. This is a great place to be. I mean, one of the reasons I came to Memphis was it has all the recipe you need for a great music therapy program. I mean, the medical side, the psychology side, the hospitals in Memphis. And then I'm ignoring the obvious when you talk about um, the music and the barbecue. We're just going to table that. Everybody knows about that in Memphis. I'm talking about just the opportunity from a standpoint of, the facilities and the foundation for a music therapy program. All the pieces are there. My job is just to connect it, which I'm working.
Right. You're working.
Definitely. I have one more question before we end our session.
Sure.
So for the people who are skeptical or the people who think that music therapy is ineffective, what would be your, not selling pitch, but how would you basically just inform them of the program and the benefits that it has for people who utilize it?
That's a great question. And I get that question every day. Every day. And I would too. It's like I tell my students, I wouldn't go to the dentist if he didn't do the dental work. I wouldn't go to a restaurant and order dinner if I didn't see the dinner. And so, I mean, there's two types of ways to kind of help people understand the benefit of music therapy. And one is you usually see the videos or you'll see testimonials, that's kind of your qualitative research background, where you've got people that talk about how much music therapy helped them or helped their child or helped their mom or their dad. And there's that. And those are kind of case studies. And that's great. And you also have the other side, which is the research. This is a field that has two scientific journals, peer-reviewed journals. So the Journal of Music Therapy and the Music Therapy Perspectives. And so we've been producing research for decades. It's not a new field. And it's, part of it is you just kind of outline the training. I mean, music therapists have to earn 1,200 hours of clinical work. That means they have 6 months post coursework working at a facility full time.
Mm-hmm.
And that coursework is very rigorous. It's not you think of music, and that's where all music therapy programs are held. The music therapy programs include abnormal psychology, statistics and research, anatomy and physiology, courses that getting a bachelor's of music, you would not think that those were courses. And those are just the core classes. And I encourage them to go on and take additional psychology undergraduate courses just to help. But the training is pretty extensive. And when you compare it to other fields, it's a standout program. And so the research that has been produced is a very sound opportunity to bring that up. The ability to show testimonials is really helpful. And then the training. So those three kind of help people to understand and putting it into a space that they understand. So for that, I mean, when I talk about research and I talk about the benefits, I usually give a scenario and I give them an example. Like, what do you mean? How do you help somebody with music? And I'll be like, give me an example of somebody like maybe you're talking about this child who's on the spectrum. And one of the issues with kids on the spectrum is they have self-stim, sometimes they do self-stim behaviors. They don't make eye contact. So you use music as a cue in that situation because they love music. You play music that they love and you teach them and you fade the music, which is a behavioral part. You just play music and they look up and then you keep playing music. If they don't, you don't play. And you try to use those kinds of very specific examples. If you're in hospice, for example, and you're working with a family, you try to do reminiscent activities and songwriting and interventions that you can engage the family and engage the loved one so that they have something when they're passed, and that the message that the person has. You also do a lot of testimonials. I mean, you do a lot of bedside where you're, helping them kind of go through the process of the end of life. Those are all big parts. And so I kind of give them the research and there's testimonials, and then give them an example. Because, if I'm, depending on where you go, like if I work in a mental health facility, the hospice and the autism examples don't resonate. But if you talk about, depending on what population they're thinking about, and we've talked in this conversation mostly about people that have maybe a medical or a psychological issue, but this is one of those areas where you can also be promoting health and wellness among healthy adults. Everybody has stress. Everybody has difficulty with coping skills and time management and those kinds of things. Music therapists can help with that as well. And so you kind of pull all that together into a package, and depending on where that person is, and usually what it is they just don't know. And if they do know and they understand, oh, well, I have a friend who has this issue, I can see how that would be helpful. And based upon what you've told me from the research and the testimonials and the training, I get it now. So that's kind of my approach.
Mm-hmm.
Great question.
Thank you so much. It seems like you've been a wonderful addition to the behavioral health community so
Thank
far.
you.
I'm excited to see how your program comes out at the University of Memphis, and for what else is to come for you in the future.
Well, thanks. Yeah, so there's a lot of music therapists working in Memphis, so we're all in this together. This is a great place.
Yep. Well, do you have anything else you would like to add to the podcast?
No, I'm good. You hit all the key points. That's wonderful.
Okay. Well, Dr. Pierce, we are very appreciative for your time. We can't wait to hear about the things you continue to do for the program and for music therapy. And we really appreciate you for taking your time out of your day.
No, thank you. Great interview.
Thank you so much for tuning in to listen to our podcast, brought to you by the Smart Connections podcast from the Smart Center at the University of Memphis, as well as the Pathways to Behavioral Health Careers Project. If you or anyone you know needs any information from the Smart Center, please contact us at 901-678-1636 or email us at smartcenter@memphis.edu. You can also learn more about us at our website, memphis.edu/smartcenter.